We are celebrating the charity Lending Hearts this March, and my special guests today are Dr. Cyrus Khan, who is with the Allegheny Health Network Cancer Institute, and a cancer survivor, Jessica Johnston. Welcome to each of you. Thanks for being here today.
Yeah, thank you.
So we're talking a lot about Lending Hearts, and I really wanted to talk to both of you because I want people to learn more about the organization and what it does. So Jessica, tell us a little bit about your journey and what was your diagnosis?
I was diagnosed in November of 2019 with large T-cell lymphoma. I had a large mass right here. It was about the size of a baseball. And I had small bumps all through my lymph nodes, but that one particular expanded. And that's when we finally were like, all right, something's up. We got to keep pushing. So I went and I was diagnosed in Wheeling. And then I was sent by Voss's recommendation to Dr. Khan at West Penn.
And Dr. Khan, when you saw Jessica, how do you treat a patient like her? What are the steps that you go through there?
A great question. So, of course, the first step is to confirm the diagnosis. So we go through ordering various imaging studies as well as a biopsy. And if a biopsy has been done as an outpatient, and by a biopsy, I mean we take tissue sampling from wherever the mass might be. And then we have expert hematopathologists here who sort of double check that the diagnosis is correct, because whenever we deal with lymphomas, they're very rare, especially the kind that Jessica had. So we reconfirm the diagnosis, and then obviously once we make that assumption and make sure that the patient is fit enough for treatment, we start a certain chemotherapy depending on what kind of lymphoma we're dealing with.
And so that's the medical side of it, but there's also the other side where you need resources. You maybe need to talk to somebody about your feelings and what you're going through. So is that where Lending Hearts came in for you, Jessica?
Yeah, exactly. As I was about a month out from my last treatment, Lending Hearts launched their young adult program. And I had known about Lending Hearts for several years because I've known Vaso for a while. But when she launched the young adult program, it was exactly for me. It was up until the age 39. I was 38. And I started to incorporate a lot of that. They have a lunchtime relaxation program with Emmy, where she really kind of guides you through, you know, learning to breathe and learning to kind of process through what you have gone through or what you're about to go through. The program that I did most frequently was their yoga program. And we did that virtually because as we started to launch these programs with Lending Hearts, everybody went into quarantine. And, you know, as a cancer patient, someone whose immune system is compromised to begin with, it's just easier to have everything virtual. So I was able to stay in my house, log in through Zoom, do the yoga classes. And it was a really nice way to process as well. We would take some time at the beginning of class, you know, other cancer survivors or people going through treatment still would log in, we would talk. You can really relate. And then we would go through the practice. And by the end of that hour, I was just in total relax mode. So I have used pretty much every offering that they have given, and everything about the entire foundation and the program and what it stands for just hits very deep for me. And I really believe in it and support it. And it's been very, very helpful.
And Dr. Khan, you know, we know that there's going to be the medical treatment, but from a doctor's point of view, how crucial is it for patients to get that type of care and that kind of service where it's really working on, you know, some of their mental health as well and making them feel better about where they are?
No, supportive care is as important as our medical treatments, if not more important. I mean, we give very toxic treatments sometimes to our patients. They're in the hospital for long stretches of time away from their family. And it's a difficult time to begin with when somebody's diagnosed, especially young patients with a cancer diagnosis, even if we have good outcomes. So just getting to that point takes a lot. And they need not only family support, support services that we provide within the hospital, but then also importantly, foundations and other organizations like Lending Hearts, which really help our patients in going through that journey in a much more positive way. I mean, that's half the battle, really. So to be honest, it's a very important component of our treatment strategy.
And Jessica, I'm going to leave the last comment open to you. What would you like to tell anyone who's watching who may be going through something about reaching out to Lending Hearts and looking at some of their programs?
Yeah, absolutely. Go for it. Reach out to Lending Hearts, check out their website, follow their social media, their programming. I just can't emphasize enough how important it is. And like Dr. Khan said, and he and I have had this conversation so many times, how oncology and medical need to come together with wellness and mindset and positivity. And you just have to dive in and give it a try. Just jump into the community, let them support you. You're going to have so many resources that you don't even realize you need yet, but they're there for you and they are so beneficial, and you will come through it strong like a warrior.
All right. Thank you so much, Jessica. Thank you, Dr. Khan, for talking to us today. Our charity of the month this March, Lending Hearts.